my case presentation is on combo plan for management of macular edema in BRVO. So I have got no financial disclosures. Next. So this is my case. A 49 years old male patient with no systemic comorbidities visited the outpatient department in July 2019 with complaint of diminution of vision in left eye. So detailed ophthalmological examination in right eye was all normal. Left eye showed a BCVA of 6/18 partial. Fundus showed retina on, disc was 0.4 and it showed IT BRVO with macular edema. Next slide. So this is the fundus picture and this is the OCT picture of left eye. So based on the clinical findings and the investigation findings, we planned to give him injection ranibizumab first dose intravitreal. So first dose was given in July 2019. Then we again checked for OCT and everything. It was a non-resolving macular edema. So second dose of ranibizumab was given in September 2019. The macular edema did not come down. So the third dose of injection ranibizumab was given in November 2019. After these 3 doses, the edema did not resolve. So we changed our plan of treatment to the next FDA approved drug, that is aflibercept. First dose of aflibercept was given in January 2020. The edema did not come down. So the second dose of aflibercept was given in March 2020. The edema still did not come down. So the third dose of aflibercept was given in June. Now we see in the graph that the edema has come down, but again there was a recurrence of edema. So now again we had to change the plan of treatment. We gave him an intravitreal dexamethasone implant in August. Now the edema started coming down, and when there were no hemorrhages, we planned to supplement it with targeted focal laser PHC. Now our patient was edema free for almost 6 months. This is the fluorescein angiogram of left eye which confirmed IT BRVO, and this is a picture of targeted argon laser in left eye. Next slide. This is the dexamethasone implant in November and in December 2020. Now in 2021, again the edema started coming. So Ozurdex second implant was given in February. Now the edema has come down. There was no edema till July, but again the CMT started increasing. So the third Ozurdex implant was given in September. Again the patient was edema free for 3-4 months. Now in next year, that is in 2022, again the patient present with edema. So again we had to give him the fourth implant of Ozurdex. During all this Ozurdex implant, we checked the IOP and we checked for cataract. The IOP was maintained. There was no cataract, and after the fourth implant, the patient was edema free for 9 months. But when the patient presented to us in November 2022, now there was a sudden drop in BCVA. There was a recurrence of macular edema and huge CMT of 614, and here the patient has started developing cataract. So we had to discontinue dexamethasone implantation, and we switched to another therapy, that is injection brolucizumab. First dose intravitreal we gave, and then in December the patient followed up. The edema had come down, the BCVA had improved. Now this is the case summary of all 4 years about the macular edema and what all treatments were given. Now this is a long follow-up case of BRVO with recurrent macular edema with multiple treatment options, but our patient was refractory to most of these. Now literature says that ranibizumab and aflibercept are FDA approved anti-VEGFs for treatment of macular edema in BRVO. There are many clinical trials to show the same, but our patient was refractory to both of these, so he had to be switched to other modalities. Now regarding intravitreal steroids and focal laser, intravitreal dexamethasone implant was FDA approved in 2009, and in comparison studies of dexamethasone with ranibizumab, initially in the first 2 months both has an equal efficacy, but in long term ranibizumab showed superior results. And there was a BVO study for focal laser. It significantly improves visual acuity in such patients, but they have a lesser efficacy as compared to anti-VEGFs. Our case was edema free for almost 6 to 9 months after each dexamethasone implant, but the edema recurred, and at last he started developing cataract, so we had to switch him. Now regarding intravitreal brolucizumab, it is FDA approved.
Please summarize.
For use in ARMD, it is an off-label use in BRVO, and there was only one case reported in literature regarding this, and there was a Raptor clinical trial which was going on, but it was terminated in 2021 in stage 3 due to increased incidences of retinal vasculitis. So we had to discuss all these pros and cons with our patient, and then we injected him with brolucizumab. So to summarize, there are no control studies investigating the effect of combination therapy, and refractory cases need newer off-label anti-VEGFs, but it should be done with extreme caution. So now I open up the hall for discussion. I have 3 questions. When the cataract has to be removed, what next? If the edema again recurs, what next? And do surgical therapies like vitrectomy and all have a role in this?
Okay, doctor, I am not able to understand what is surprising. You seem very surprised by the edema recurring.
Yeah.
We would be more surprised if it was not recurring. Because we do expect, once you have a vein occlusion, this is for life. So day in and day out, all our patients keep coming. That's not surprising, that is expected. Second, I don't understand is why you stopped Ozurdex simply because you had cataract. You were already anticipating cataract once you started Ozurdex.
Yeah.
So just do the cataract surgery and continue Ozurdex because it was giving you a good response. I don't know why you changed, because there was no steroid response in terms of IOP rise.
Yeah.
So you had no contraindication actually. Now you shifted to a more dangerous drug which can actually cause retinal vascular occlusion and neovascular glaucoma. So there was no need for you to change at all.
We could have continued.
You should continue.
And BCVA was with the change in CM, like the edema was coming, BCVA was constant or was it deteriorating?
It was deteriorating when...
Every time?
Yeah.
Every time?
Then
because
again it was coming to
because
base.
only if edema is coming, if it is only IRF, then you can still wait. If it is not SRF or sub-RPE fluid in case of RVOs. Only IRF, if it is not affecting the vision, then you should not keep on injecting just for drying
No,
up the
BCVA
macula.
was also coming down.
Okay,
Patient
so
was
that should have
complaining.
mentioned. It is only based on CMT.
Okay, we go to the next talk now.
The BCVA.
Yeah, my point is to just repeat an FFA, see the area of ischemia. If there is a ischemia is progressing, you can do some selective grid laser to the ischemic area, repeat intravitreal Zodex or anti-VEGF. And if there is any macular traction is there, then you can plan surgical intervention.